Good afternoon. It gives me great pleasure and an honor and opportunity to speak to you today. My name is Muzammil Ismail. I'm a public health registrar. I work with the Western Cape Department of Health as part of the outbreak response team for COVID-19. And today I'm just going to be going into basically an overview and a context of COVID-19 globally as well as in the Western Cape. I'll be spending a few minutes looking at the context of COVID-19 in terms of the various phases of an epidemic, where it originally started, how coronavirus looks like in South Africa, specifically in the Western Cape, and lastly just touching on what the impact of contact tracing is. Theoretically, the phases of an epidemic are divided into 5 separate parts. Generally, the different phases are experienced in different times and at different rates depending on where you are. So even between a context like South Africa, different provinces experience different phases of an epidemic at different times. The first 3 phases of the epidemic basically focus on sporadic cases, clusters, and then moving into the main wave. The first phase is where you get mostly imported cases and very little local transmission happening in the community. As soon as we move into phase 2, we start to see clusters of cases occurring, and in our setting, we saw this happening around essential services, particularly around grocery stores and around healthcare workers. And essentially, the third phase is where you get community transmission. This is when there's widespread transmission, there's very little imported spread anymore, the virus is basically rampant in the community. The fourth phase speaks about a full epidemic, when there is a considerable amount of pressure on the healthcare services. And the fifth phase speaks about a late epidemic, where we start to see declining number of cases. The epidemic originally started in December of 2019 in Wuhan city in Hebei province, China. It was initially associated with an animal market, and this really amounted to an initial animal to human spread. But thereafter, we experienced established human-to-human transmission. By the first week of January, China experienced their first COVID death, and Wuhan went into lockdown in mid to late January. By the end of January, WHO announced that COVID-19 was a global pandemic. From the middle of January, COVID-19 spread essentially by droplet and contact mechanisms via travel routes to the Northern Hemisphere. It initially targeted places like North America, Canada. It moved south to Australia. Western and Central Europe were affected next. By the middle of February, we see our first cases landing on the African continent in Egypt, and thereafter it really spread across the world, with very little countries not being affected by the transmission. How does coronavirus look like in South Africa? Well, by the 5th of March, we experienced our first case. This then slowly increased in terms of the number of cases up until the 21-day lockdown, which was announced on the 28th of March. The trajectory up to that point was an exponential trajectory. And from the 21-day lockdown, which coincided with our first reported death, we started to see a slowdown in the transmission and the rate of transmission in our context. This was further extended when we instituted the 14-day extension of our lockdown, and by the end of April, we experienced a total of 5,500 cases in South Africa. What does coronavirus look like in the Western Cape? Well, we experienced our first case on the 10th of March, and initially, as per the theoretical phases of an epidemic, most of our cases initially were imported cases. But this over time became more and more widespread in the community. And by the end of the first 4 weeks in the Western Cape, we had a total of 500 cases, 11 deaths, and we had done more than 10,000 tests. The epidemic really started in the western parts of Cape Town. So the blue dots on the screen are the imported cases. And what we started to notice was a spread from the western part of Cape Town and moving across to the eastern part of Cape Town. The orange dots representing local spread. And what we see is that we see an increasing amount of local spread. By the end of the first 4 weeks, we hit a key turning point in the epidemic where our local spread numbers were more than our imported cases. By the first week of May in the Western Cape, we were around 3,500 cases. And essentially, we were averaging about 200 to 300 cases per day. And what you notice on the graph on the screen is that from the middle of April to the first week of May, we hit a new trajectory and we were increasing exponentially. From the middle of May to the middle of June in the Western Cape, we continued on this trajectory And by the middle of June, we see ourselves at more than 50,000 cases. And this is now where we compare to other provinces where Gauteng and the Eastern Cape are starting to see their exponential growth starting to occur at this point in time. When we look at the city of Cape Town from the middle of May to the middle of June, what you start to notice is that there are cases that are occurring in all areas, in all sub-districts and in all suburbs across the city of Cape Town. There's no clear geographical distribution in the cases, and this just speaks to the phase that we are in as a city and wider as a province, that the geographical distribution is really scattered across the whole city and across the wider province as a whole. So this provides really an overview up until the middle of June of total cases in the Western Cape, and it's a representation of our public-facing coronavirus dashboard. And essentially what you see is a continuous increase in number of cases cumulatively over time. What we also start to notice is that the majority of the cases sit in the 31 to 40-year-old age range, but the mortality and the majority of the deaths come in the 51 to 80-year-old age range. In terms of contact tracing, we've been carrying out the contact tracing efforts from the beginning of the epidemic. And the data that we've come to gather up until this point has shown that out of all contact tracing that has been done, 15% of patients come back as symptomatic. And these patients definitely require testing in order to investigate them further for COVID-19. And this is how we sort of mitigate against the further spread to families and to the community as a whole. They call this boxing in the virus, where we widely test, we isolate and identify contacts as quickly as possible, and we quarantine those patients that are not symptomatic. In the Western Cape, we have a differentiated strategy to the various phases of an epidemic. In the early phases, we were concerned about epidemic preparedness when we had no cases. We tried to stop transmission when we had sporadic cases. But at this point in the epidemic, we focused more on containing and mitigating against clusters, as well as protecting the vulnerable populations and the health workforce from further community transmission. I wouldn't be able to do a COVID-19 presentation without speaking about hope. And the important thing that I want to speak about here is that despite these increasing numbers, it's important to note that we do have an opportunity to mitigate against these increasing numbers. There is an opportunity to limit the spread and to protect our vulnerable communities. In order to do this, we need to carry out continuous contact tracing to limit the spread further. Last but not least, I would just like to take this opportunity to say a big thank you to all those that have contributed in making this possible. That includes our Provincial Health Data Centre, all the contact tracing teams, the pods, the various people that have supported this effort in containing the spread of coronavirus in the Western Cape. Thank you.
Hi, I'm Masuda Palika. I'm a Public Health Medicine Registrar from the Western Cape Department of Health. And I'll be speaking today a bit more about case and contact tracing, what this means, and then how you would fit into this process flow for the outbreak response in the Western Cape. So I'll be speaking today a bit about what is case and contact tracing, and then I'll move on to the phases of the epidemic and the outbreak, who can do contact tracing, an organogram of the outbreak response team in the Western Cape, and then also the process flow of how we conduct case and contact tracing in the Western Cape. So what is case and contact tracing? Case and contact tracing forms one of the big strategies in managing and containing an outbreak. It is divided into case management and contact tracing, where case management focuses on the case and includes contact tracing of the contact and ensuring they are informed and quarantined. When this process is systematically applied, contact tracing will break the chains of transmission of an infectious disease and is thus an essential public health tool for controlling infectious disease outbreaks. The epidemic has different phases, so the use of case and contact tracing will evolve depending on the phase or stage of the epidemic that we are in. There's definitely a place for it at each phase, but the implementation needs to adapt to have the best outcome and for it to continue to add value to the outbreak response. The 5 phases of the epidemic, starting initially with sporadic cases, then clusters, and then the main wave, which becomes a full-blown epidemic, and then phase 5, which is the declining number of cases. In phase 4 of an epidemic, there's widespread community transmission, which has its effects on the healthcare system of the region. The diagram here links to the 4 phases of the outbreak response, which is number 1, epidemic preparedness, number 2, stopping transmission, phase 3, contain and mitigate, and then the final phase, which is to protect the vulnerable and the health workforce. So in phase 1, following the World Health Organization declaring COVID-19 as a global pandemic, each country needed to prepare themselves. In South Africa, this was done by screening of all of those entering and leaving the country. The national and provincial governments were tasked with preparing laboratories, identifying designated hospitals, and confirming standard procedures to follow when suspected cases enter the country to prevent the spread of the virus into the more vulnerable communities. For the Western Cape, this timeline was in February and early March, and we had set up groups to prepare for any cases that arrived so that contact tracing can commence. So in phase 2, there are sporadic cases as people enter an area either by international or national travel. And the goal here is to isolate all confirmed positive cases and control transmission of the virus by quarantining the contacts of these cases. In the initial phase of contact tracing, teams would contact cases on the same day that the confirmed positive lab results were received, and then ascertain all their contacts of the case and ensure that these contacts self-quarantine. It also involves the monitoring of these contacts so that should they become ill or deteriorate, they are able to access a health facility if they require. All patients accessing facilities for healthcare are screened and triaged into either suspected COVID or non-COVID cases. In this phase, there is evidence of local transmission. Initially, clusters of cases were detected, and this was initially among social gatherings such as weddings, and then also with international travelers, and also later included workplace clusters, which formed a large part of the initial community transmission phase of the epidemic. Workplaces were given the instruction to help contain the spread of the workplace environment by ensuring adequate protocols are in place to protect their workers and their clients or customers. The goal in this phase is to contain epidemic and prevent widespread community transmission using mitigation steps. Contact tracing efforts are intensified here, and the teams conducting the contact tracing would increase in size. We also broaden the index of suspicion, and hereby means broadening the case definition to be able to include those in the community who haven't had recent travel history. And it also means the beginning of testing of both symptomatic and asymptomatic contacts in this phase. The final phase of the epidemic is where there is widespread community transmission, especially in the more densely populated and poorer communities. Case and contact tracing is still valuable here, but as mentioned earlier, the role has to be evolved to be more valuable for the current phase of the epidemic and to be able to keep up with the vast numbers of cases we are receiving daily. It is no longer aimed at stopping the transmission, but rather aimed at protecting these high-risk individuals, and these would be those over the age of 55 or those with comorbidities who form part of the vulnerable groups. Testing is reserved for these individuals and also healthcare workers, including those who have severe illness. Nonetheless, contacting cases and tracing high-risk contacts is important. This is to identify, isolate, and thus protect these groups so that we can avoid somewhat preventable morbidity and mortality. Throughout all these phases, the focus of case and contact tracing is to ascertain risk, prevent further spread, and give agency to the person you are speaking to so that they are able to take charge of their own health and acknowledge their responsibility in reducing the spread and know what to do in the event that their condition deteriorates. So who can do contact tracing? It is helpful if you have some health-related training, as you will be talking to patients who may have a lot of questions regarding their health and the health of their loved ones. However, you do not need to be a consultant physician or public health medicine specialist. All you need to be able to do is to speak confidently to people in a calming manner and in simple language that is easy to understand. Your job as a tracer would be to provide cases and contacts with information until they comprehend their situation. And this can take some time and may require some counseling to get the message across. Understandably, some cases and contacts you speak to could be anxious and afraid, so empathy is very important to get the message across. Also keeping in mind varying social and economic contexts of the cases and contacts, many of whom fall into the lower socioeconomic bracket and have less access to certain resources. In terms of commitment, the tracing teams do not necessarily need to work every day. Whatever you are able to commit to would be beneficial, even if only a few hours a week. So where do you fit in? To describe the structure of the team, there is a central coordinating team for the outbreak response in the province that provides support to both the metro and the rural health services. Initially, contact tracing started at the central level and cases were reported centrally and then divided among individual contact tracers who individually managed cases and contacts and referred on to the various substructure offices for further case management. With the increasing caseload, these individuals developed smaller teams or pods with a pod leader overseeing the contact tracers, but still referring each case and contact onto the field teams within the substructure offices for further case management. With the progression onto the next phase of the epidemic, the approach has become decentralized, where although there is still a central team supporting the metro and rural health services, the substructure teams drive the outbreak response and assign cases to pods that are directly linked to them. This flow has improved efficiency as tracers work more closely with the teams on the ground and can focus on the vulnerable groups and other high-risk cases and contacts more easily. Each substructure works slightly differently, but the main flow is cases are pulled through onto Single Patient Viewer or SPV, which is our central database. The substructure teams draws the case line list from the cases which fall into their subdistrict and distribute it to the different pods. The pod members then undertake the contact tracing by calling the case, ensuring they are isolating, finding out further information such as comorbidities, food insecurity, and need for further isolation or quarantine facilities to assist. They then call the contact and ensure that they are quarantining, among other things. A baseline case record form is completed, which is then in turn sent to the substructure team pod and pod leaders, and also sent for the data to be captured onto SPV, our central database. As the number of cases in the Western Cape grows, so is the workload. This is why we need more people, more volunteers to assist our pods and our teams to do contact tracing more efficiently so that we can control the spread of the virus and help make a difference.
Hi, I'm Jenny Durant. I'm a GP, and for the last 3 months I've been a volunteer contact tracer and case caller for the Western Cape Department of Health. What I'm going to do now, though, is I'm going to tell you what I love about contact tracing, and that is that we're going from the big numbers and the 50,000 cases right down to that one person. Our job as a contact tracer is to give hope to that person and to give them a sense of agency and a feeling that they know what to do. It's lovely really being able to engage and show empathy and make people feel empowered. So our first job as a contact tracer and case caller is simply to show care. We've got someone on the other end of the phone who might be feeling unwell, might be scared, or be anxious and afraid and scared off for all sorts of different reasons. And we are helping to allay their fears and tell them how to look after themselves, how to look after their loved ones and the people around them, and helping them to have a sense of responsibility in what they can do to slow down the spread of this disease. So we do that by something which in medicine we call a biopsychosocial approach, where we don't only think of people's bodies, but we also think of their minds and their social context. And for medical students, we teach something called a 3-stage assessment, and that's pretty much what we're doing on the phone. So we're doing the first bit, which is clinical, how the person is, how are they feeling, what are their particular risk factors and vulnerability. The next bit, which is maybe the most important, is the individual or psychological. So what are their ideas, their concerns, their worries, and how can we address them? And then the third bit, of course, is the contextual or their social context. And here we want to know how they live so that we can answer questions like, are they able to self-isolate or do they need an isolation facility? What is going on for them about work and do we need to do anything about that? Are they able to get food and do we need to think about a food parcel? So that is the 3-stage assessment. Or the biopsychosocial approach. That's the theory, and what we're now going to do is give you a flavor of what it actually feels like to do it by doing a very simple role play. I'm going to be the contact caller. I'm going to have a patient on the other end of the phone, and we're going to just give you a feeling about what it actually feels like to be doing it. It's going to be a simple case. It's not going to answer all the questions. It's going to leave a lot of stuff out, but it will hopefully give you an idea of what it feels like to do it and raise some issues and questions for you. You will, as a contact tracer, be given a kind of script to follow, but it's far more important to use the script as a checklist and just be patient-centered and respond to what the patient is saying, because that way you can really show empathy and give agency. So we're going to go into the role play now, and after that, Carol Craig is going to go over some of the additional or common questions that need to be raised. Thanks.
Hello.
Hello, is this Gonda Perez?
Gonda. I'm Gonda.
Hi, Gonda. I'm Dr. Jenny Durant. I'm phoning you from the Department of Health about the corona test that you had recently.
Yes, doctor, I had it a few days ago.
I'm wondering if you've been given the result yet?
Not yet.
Okay. Gonda, can I ask how you're feeling at the moment?
I have a slight fever. My chest feels tight. I seem to have lost my sense of smell.
Oh dear, okay. That all sounds quite uncomfortable. And tell me, why did you decide to have a test for corona?
Well, I work at Checkers, and some of the other people at the shop where I work tested positive. And when I felt symptoms, my manager said I better go and test.
Okay. So what I'm hearing is that you've actually got quite typical symptoms of a reasonably mild corona infection, and that you have had a possible corona contact. And so I can give you the result of the test now, and that is that you did actually test positive.
Oh, doctor, I get a bit worried about that. What about my children? I have 3 children and I'm really worried.
Yeah, it's a bit overwhelming, isn't it, to hear that that's what you've got? I can understand that. Gonda, can you just tell me a little bit about your children?
I have 3 children, 18, 14 and 5, and they live with me in the house. Yeah.
Okay. And do any of them have any particular health problems?
No, none of them have health problems. They're all fine.
That's great. And are any of them having any symptoms that you could think might be similar to yours?
Not at the moment. When I went for the test, they advised me to move my youngest son out of my bedroom. So he's sleeping in the other bedroom with the other 2 boys.
Well done. That was a really good move. So you're protecting them already. So Gonda, what I can tell you is that we feel that corona is not a serious infection for children, especially for young, healthy children like yours. We know that they're less likely to get corona. And if they do get corona, it would be very unlikely that they would have a serious illness. They might have a bit of a cough, a bit of a cold. They might not have any symptoms at all. And usually they would recover very quickly without any problems.
Thank you, doctor. That's reassuring to hear.
Every time anyone has a positive test, we like to try to give them a call to find out if they know what they can do to look after themselves and what they could be doing to look after the people around them. It sounds as if you're already doing a great job of looking after your children, but we'll come to that.
Thank you.
You told me that you've got a bit of a fever, cough, you lost your sense of smell, and your chest is a bit tight.
Yes, that's right.
Can you tell me a little bit about what you mean by a tight chest?
It's difficult. When I cough, then I feel a bit short of breath, and it feels like my chest is hurting. And a bit difficult to take a breath when I'm coughing.
Yeah. Is it only after you've been coughing that it's difficult to breathe, or are you having difficulty breathing at other times?
It's just when I cough, and seems to just be difficult to catch a breath but other than that, I'm okay.
Oh, that's good. So when you do just very ordinary things around your room, like getting dressed or perhaps going to the toilet, do you feel at all short of breath?
No, I'm fine at those times, yeah.
Okay, that's great. So Gonda, from what you're telling me, that's not the kind of shortness of breath that we worry about when people have COVID. You might have seen or read about people struggling to breathe with COVID, but it's not the kind of tight chest and a bit short of breath after coughing. That's just normal for someone who has a cough. Okay. So any other symptoms?
No, just that. And as I've said, the slight fever. What do I do for that, doctor?
You can just take Panado and treatment like you would take for ordinary flu. And I'll tell you a little bit, when we've spoken a bit more about you, I'll give you a bit of advice about what you can do to treat yourself. Can I just check a few more things though? Can you remember what day your symptoms started?
It was on Saturday because I went for the test on the Monday.
Okay. And today's Tuesday, so that was round about Saturday the 14th, would that be? No, but before that, Saturday the 13th. So they started on Saturday the 13th, and so it's now about 8-9 days since you became ill. Is that right?
Yeah, and I'm starting to feel a bit better today.
That's really good to hear. That must be a relief for you too. Yeah. Gonda, just tell me a bit about yourself now. My bit of paper says that you're 38 years old. Is that right?
That's right. I'm 38.
Okay, so you're young. Not quite half my age, but pretty young. Young enough to have a strong, fit body. And do you have any other health problems? Any chronic illness?
I have high blood pressure and I'm taking some medicines for that.
And do you know anything about high blood pressure and corona?
I heard that it's a bit of a problem when you have high blood pressure. So what does it mean? Will I be more ill?
Yes, we do know that people who have high blood pressure do sometimes become more ill with corona than other people. And so it's definitely something that you have to kind of watch. On the positive side, firstly, you're only 38, which might not feel young at the moment, but that's pretty young. And for most people your age, even with blood pressure, your body would be strong enough to just fight off the corona without getting worse. That's the first thing. And the second thing is you're already starting to feel a little bit better. It's about 8 or 9 days since you got symptoms. So you're really over the sort of danger period when people would be getting worse. So having high blood pressure is a little bit of a risk factor, but also it sounds as if your body's dealing with it very well.
Thank you. That's reassuring to hear.
Yeah, good. So can we talk a little bit about how you can be looking after yourself and helping yourself to get better more quickly and to feel okay?
Okay.
Okay, so what have you been doing at the moment?
Well, I've heard that tea with honey and ginger helps. And I've been drinking that and sometimes taking Panados when the fever I feel a bit too hot. But other than that, I haven't taken anything else.
Okay, well done, firstly, because whatever you're doing, it's obviously working because you are getting better. And you're quite right. I mean, taking Panado if you need it, taking a bit of cough mixture if you need it, that is a good idea. I kind of divide corona treatment into two things. And the one is what you do to make your body feel fit and strong and able to fight the virus. And that's the rest and the tea and the bit of honey and ginger and those things that you're doing. And then the other bit is what you do to make yourself feel better while your body fights off the virus. And that's the Panado and the cough mixture and the fluids. But it sounds as if you're doing everything right. Well done.
Thank you. Yeah. But what about my children? What if they get symptoms? What do I do then?
As I said before, children, when they get corona, usually have very mild symptoms, and they usually fight it off just the way they fight off any cold and flu. Have your children had colds or flu before?
Well, previous years they would get cold or flu. They haven't shown any symptoms at all this year.
Oh, that's great. So, in exactly the same way you treated them before when they had colds or flu, with a bit of cough mixture, maybe a bit of lemon, honey, letting them rest a bit. It's exactly the same treatment that they need now. In that way, it's no different from any other flu. And there's not a specific treatment that they need because their bodies will just fight it off.
Okay, good.
Okay. So, Gonda, getting back to what you need to do apart from kind of the medicines to take, the other bit of it is just watching yourself for symptoms. So can I just explain to you how corona usually develops? So most people with corona find that after 5, 6, 7 days, they're starting to feel a bit better, and then their body just slowly recovers. A small number of people, round about day 5 to day 8 or 9, usually about day 8, instead of getting better, they start to feel a little bit worse. So their fever might go up a bit, they might get a bit short of breath. And that's the thing to watch out for.
What do I do if my symptoms get worse, doctor? Do I go to the clinic?
The first thing is don't panic, because most people, even if their symptoms do get worse, even if they need to go to hospital, most people, especially your age, will still just get better without needing ventilators and all those scary things. But no, please don't go to the clinic. Clinics are very overloaded at the moment, and you would wait a long time and you'd be surrounded by a lot of other sick people. The Department of Health has set up a really good provincial corona hotline. And the best thing is just to phone them.
Okay.
They answer pretty quickly. They can give you lots of advice. They can tell you exactly what to do. If they think that you need to go to clinic, they'll let you know. And the other really good thing is if they think that you're so ill that you need to go to hospital, they would arrange an ambulance for you.
Okay, good. Thanks. Good to know.
Yeah. Okay, so that's pretty much what you need to be doing for yourself.
So must I stay at home, doctor? What do I just stay in my room, or what do I do?
Thanks for asking, because that's the next thing we're coming to. So the next thing we're coming to is how to look after the people around you. And we're going to start with your children, because they're in the house with you. Does anybody else live in the house with you, within your home?
It's just my children. I have tenants in the Wendy house, but they don't come into the house.
Okay. Do they share the bathroom or the toilet or the kitchen with you?
They have their own bathroom and toilet outside. Yeah.
And have they been visiting you? Have you been spending time in each other's houses lately?
Just wave at them and say hello. We haven't spent time together at all.
That's brilliant, Gonda. So you've protected them by not spending time with them, and you've protected your children by moving your 5-year-old out of your room. So you're doing a great job.
Thank you.
Yeah. So really, to prevent spread within your house, the thing is you do need to stay in your room.
So I can't go to the kitchen.
I'm sorry to say, you're going to need to tell those children that they've got to do the cooking, they've got to do the cleaning, they've got to do the looking after of mother from a distance. You shouldn't go to the kitchen at all. Obviously, how many bathrooms do you have at home?
I just have the one bathroom.
Okay. So obviously you need to go to the bathroom and the toilet, and it's fine to do that, and you can do it in a way that is quite safe and protects them. So remember that you can spread corona from your mouth or from your hands. So you stay in your room all the time, but when you do need to go to the bathroom or toilet, you need to cover your mouth and nose and clean your hands. So if you can have a little bit of sanitizer and keep it in your room, then just before you go to the bathroom, you first put on a mask, then you sanitize your hands, and then you go to the toilet. Try to touch as little as possible. Try not to touch handles and light switches, etc., if you can help it. But after you've been to the toilet, it's very helpful to have a little container with some bleach in the bathroom or toilet, with some bleach in a cloth. And before you leave the bathroom, just clean every handle or any surface that you have touched.
Okay.
So your children can make up a solution with about 6 teaspoons of bleach in a litre of water, make it up fresh every day, and just leave it there for you. So Gonda, is that okay about the bathroom? Do you understand how you can use that safely and still protect your children?
Yes, thank you, doctor. So I go in and use the bleach and water and wipe everything down after using the bathroom, before and after using the bathroom. Mm-hmm.
Yeah. Remember, sanitizing your hands before you go to the bathroom protects the people around you.
Okay, good.
Now, what about the kitchen, Gonda? Do you think you're going to be able to stay out of the kitchen?
Oh, that's a difficult one. It's hard, but the children will have to try to manage. I suppose the same thing if I do go to the kitchen, that I wash my hands and wipe off taps and things, doctor. Is that right?
Gonda, I think you need to tell them that you are the hotel guest and they are the room service. And what they do is your food gets prepared in the kitchen, they leave it outside your door, they knock, you come and get it, you leave your plates outside, they take them away and wash them. Make it a game for them and maybe they'll understand it. If you have to go to the kitchen, that's really second best. But if you do have to go, then all the same things apply. Sanitize, put on your mask, sanitize, bleach every surface.
Mm-hmm.
Okay.
Okay, good.
When they do wash your dishes, just ask them to take them straight from outside your door into some hot soapy water. They need to also sanitize their hands after washing them and rinsing them and drying them, and maybe keep some dishes aside that are just for your use. Okay. So that's how to protect your children, but then the next step is how your children stop this from spreading outside your home.
My son is in matric and he's supposed to start school, so do I keep him at home?
Yeah. Has he been at school for the last couple of days?
No, I've been a bit worried about the school, so while I was waiting for the results, I kept him at home.
Oh, Gonda, you're a star. You know, I wish everyone was as careful as you are. I really do. Well done. But you were absolutely right to keep him at home. So it takes 2 weeks from the time you get symptoms until the time that the virus is no longer infectious in your body. Okay? So that means that you yourself need to isolate from 2 weeks from the start of your symptoms. And you told me your symptoms started on the 13th. So you need to be isolated from everyone in the house until the 27th.
Okay.
In the same way, your children need to be isolated from everybody in the outside world for 2 weeks from the time you had your test. And that means, I'm afraid, that your children should be in the house. They shouldn't be going outside. They shouldn't be having friends to visit. They shouldn't be visiting friends. Your son shouldn't be going to school. And if possible, even in the house, just if they can, wear masks and keep a little bit of a distance from each other, if they can do that. It also stops one of them from spreading to the others if they get ill. How do you think they'll feel about that?
Well, I think I've convinced them to stay home and get videos and things to watch here and stay indoors. No children like playing outside, but they've been good so far. My eldest son worries me because he's worried about people at school knowing that I've tested positive.
I think that's a conversation for you to have with him. Is it the kind of stigma of it or that he's worried about?
Yeah, people say bad things about people who have COVID, and I don't want him to be teased and bullied about this at school, so...
Yeah, I can understand that. And obviously, as a mother, that would be a big concern for you. I think you need to have a conversation with him. So you could, as a mother, just give him a sick note and say that he can't go to school for 2 weeks, and you don't have to say why. And that's your right as a mother. If he is prepared to let people know, if he's not scared of that, then we could do a letter. It wouldn't say that his mother had COVID, but it would say that a close contact of his has had COVID and that he can't go to school for 14 days. I think that it's a nice way to go because it sets a good example to the people around him. And also the teachers would be really grateful if they knew that he was protecting them rather than putting them at risk.
Okay, I'll talk to him and see what he says.
Sure. And you've got my number now, so if you'd like me to have a chat, if he's got any questions and you'd like me to have a chat, you're welcome to get him to call me.
Thank you, Doctor. I'd appreciate that.
Just remember, Gonda, talk to him from a distance and don't share your phone with him.
Okay, I'll try not to.
Okay. So that's the people in your house. And then in the couple of days before you got ill, apart from going to work, did you have any other house visitors or close contact with anyone?
No, these days we can't go anywhere, so I haven't had anybody at home.
Fabulous. Well done. That's great. And what about your work? I think you said you worked, did you say Checkers or ShopRite?
Yeah, Checkers. I work at Checkers, and I have let them know that I've gone for a test. Should I phone them now that I've tested positive?
I think you should, yes. Yeah. I think you said that other people at work had tested positive. Is that right?
Yes, that's right. Other people did test positive, yeah.
Okay, so they obviously know that, and that means that they'll know what they need to do about it. And it's really good that they were open with you about it, because it means you've been able to check yourself. Would you like me to give you a letter for work, just explaining that you're positive?
Yes, I'd like a letter for work. It will help me to get proper sick leave. Otherwise, they take the days off my salary.
Oh, yeah, and that's not fair, is it? Sure, Gonda, so I'll do a letter for work and I'll just say that you've tested positive, it's been confirmed, you're allowed to go, your isolation is till the 27th and you're allowed to go back to work on the 28th. Is that okay?
Thank you very much. I'd appreciate that.
Great. So, Gonda, I think we've gone over everything we need to. Does that leave you with any questions or anything you want to ask?
Oh, no, just about my children, So I can't take them to the clinic if they develop symptoms. I'll just treat them at home the way I am treating myself. Is that okay?
That sounds exactly right to me. Obviously, if you're worried about them, you can phone that same hotline and get advice. Are you comfortable with that?
Yeah, I can phone them. Yeah, I'll phone that line and see what they say. Thank you.
Any other questions you'd like to ask?
No, thank you, Doctor. I really appreciate this call and the chance to talk to someone. Thank you.
Great. So, Gonda, thanks very much for taking the call and thanks for being open about it. So just to sum up, you are positive. We've talked about just carrying on treating your symptoms, watching out for shortness of breath and what to do if you get it. You're going to isolate from your household until the 27th of June. You're going to persuade your children to be your waiters and chefs and keep And they're going to isolate until the 27th of June. I'll send you a letter for work. And if your son has any questions or wants a letter for school, you'll let me know. And then just to reinforce, because this is a lot of information I think I've given you, so just to reinforce that, is it okay if I WhatsApp you a few bits of information just as a reminder?
Thank you, Doctor.
Great. Okay, Gonda, thanks for the chat. You've got my number. Call if you have any questions, or actually better WhatsApp me if you have any questions. And I hope you continue to do as well as you're doing. I love your concern for your children. It sounds as if they're very lucky to have you looking after them.
Thank you. Well, now they're looking after me now.
And that's how it should be.
Okay.
Bye, Gonda. Take care. Bye.
Hi everyone. As Jenny said, my name is Carol Craig. I'm also a member of the Provincial Outbreak Response Team. But more importantly, I am a pod mama, or a pod parent, if we want to be politically correct, of the Kaya pod that is linked to the Khayelitsha Eastern substructure. And it is from that angle that I am going to be bringing it all together as we reach the end of this training. So an overview of my presentation is that we're going to be recapping the structure of calling a case, including the completion of the baseline form, which has been referred to earlier. Also, we're going to be looking at some of the challenges we encounter in making these calls, some special scenarios, and we'll end with a reflection by case and contact tracers, and even some feedback from our clients. So the elements of calling a case, as Jenny introduced before the role play, was really around introduction, psychosocial support, biological information, socioeconomic status assessment, and then the management, which really includes empowering the case and planning, and then gathering details of the contacts and doing similar inquiries. So as far as the introduction goes, and you will have seen this played out very well in the role play, which was really best practice. Introducing yourself as coming from the Department of Health, Western Cape, confirm that you're speaking to the correct person, and check whether the case has received their results yet, and if not, needing to relay those results, and then explaining the purpose of the call. Then there is the psychosocial support, and what I've put psychological up front in this approach because in many ways it underlies almost everything you do on that call. And the empathy that has been spoken about earlier really derives from this providing of psychosocial support. So really what it often involves is supporting the case in coping with the news of the result and understanding its implications, and assessing any need for ongoing or additional psychological support. And that one can provide oneself or other members of the pod are on call to be able to assist with that. Then there's the bio part of the biopsychosocial, and here we're looking at information on testing, what reasons, when and where, any contacts were there at work or other. It gives some idea of transmission. And then also assessing the clinical risk, and that would be related to age and comorbidities, and also the symptoms, past symptoms, current symptoms. And this is going to give one a far better idea of how one can advise and make a plan with the case, a plan that is realistic and is really tailored to their particular condition. One doesn't want to be giving false reassurance. And then we need to assess the need for any immediate clinical follow-up, or if one has identified a fairly high-risk case that one would want to be checking in on over the course of their illness. And then we're looking at the socioeconomic conditions here, and as been mentioned in the role play, we're wanting to assess living conditions, number of people in the household, what the living conditions actually are in terms of the structure of the house, any hawkies in the backyard, and so on, with the underlying aim of trying to assess whether the case and the context are going to be able to isolate. Also to assess the level of food security or insecurity with a view to providing food parcels if that need is identified. And then, as part of the social assessment, to be looking at the contact details of close contacts, usually in the household and other personal contacts. There was a time then we used to collect workplace contacts as well, but that phase of the epidemic, thankfully, we have moved through that phase and businesses are being able to collect that information themselves. And then we come to the management, and this, as I mentioned earlier, is really around empowering the case, giving them agency, and making a plan together in order to cope with the rest of their illness. So a lot of this revolves around providing information on the illness and what to expect, which, as I mentioned, is going to be tailored to the particular condition of your case. And we do have a lot of resources that the province has produced over this period, some of which can be WhatsApped to reinforce information. And again, also around hygiene practices, personal hygiene and keeping surfaces and whatever in the home clean. Then the details of what is involved in isolating and quarantining. And Jenny in the role play went into enormous amount of detail on that. And that is really important because this is our attempt to actually intervene with transmission. And then there's the monitoring and managing of symptoms. So empowering the case to be able to monitor their symptoms on a daily basis and to manage them at home as long as they are not particularly serious. But most importantly in the end is to be able to identify if their condition is deteriorating, particularly developing shortness of breath or respiratory pain, and to make a plan as to what to do if that happens. And this would differ obviously between private sector patients who might have their own caregiver lined up and our public sector patients where we have to make very specific plans as to how they would get to the appropriate facility. And then there is gathering the details of the contact. And generally we can do this household contacts from the case directly, or if they're outside of the household, we would try and call them. And again, the aim there is to just assess whether any of those contacts are high risk, symptomatic, and to encourage quarantining of those contacts. So that really is just flipping through the elements using that biopsychosocial model of how you're going to be tackling your interview. But I'm repeating again that you will develop your own style. And I want to also say now, and I will say it again, that you must not feel overwhelmed by this task of making this call. It may seem an enormous amount of information to be gathering. You may be concerned about coping with the case's reactions and emotions. But remember, you will be given a script. The baseline form will also, which we're going to be looking at now, will guide you. But most importantly, you have your pod. And there are pod parents and there are many experienced pod members who can guide you in the cases that you do. I'm just going to go very quickly through this baseline form. Now, having conducted your call in whichever order and flow that you have developed, the information does have to be recorded on this form because it in the end will be captured into the Provincial Health Data System, which Muzamil and Masuda have both referred to. The green fields on this form are the ones that are mandatory, and their completion is actually going to allow for quite useful analysis of risk factors and morbidity and so on. So the form is largely divided into about 5 sections. We'll see that the first section is really the demographics. All of these details will actually be provided to you on the case listing you will receive when you take the case on, and it's really a case of just confirming the name, details, and so on. There is a section then around occupation and work, and we have talked about that already, just trying to assess whether you might potentially have spread the infection at work or even acquired it at work, and a particular focus on health workers, and we are keeping particular stats on these healthcare workers. And then a few details about the test, and then the bio part of the investigation. And there you can see the whole list of symptoms that you'll inquire about, whether the case has actually been hospitalized, and then those risk factors that I think we're all probably familiar with at this point in time. Importantly, to note that the date of symptoms is specifically recorded, as is the date of test, because the pieces of information are going to help you determine the isolation period for that case. Then we come to the socioeconomic section, which is asking about the household composition and the type of dwelling, and again, that assessment of whether an isolation facility is going to be required, assessment of food security or whether a food pass is required, and then really the nitty-gritty of the close contacts. We're wanting to determine if any of them are symptomatic, if any of them are high risk, because that has implications depending on the testing criteria at the time. But certainly high risk symptomatic contacts are going to be needed to be tested, and any other non-high risk but symptomatic contacts should be regarded as being probable cases. And then there's a section for recording more specific details of the contacts. So having completed that baseline form, you're going to be sending it off to your substructure team where it will be sent on for further data capturing and that. But you will also mention in your submission any additional tasks that need to be performed, such as applying for quarantine or isolation accommodation, for food parcels, needing additional counselling or specific counselling, or asking the field team to actually visit the home, community health workers to actually visit the home. We are going to end off this presentation by looking at some of the challenges we encounter and some of the specific scenarios. Communication can be a challenge, particularly with language or possibly an age difference between investigator and case, but then that's where the pod comes in. We have a lot of people with different language abilities and of different ages. Dealing with the emotional reactions of the case or contact, remember the big word here is empathy. Responses to news of the result. Lack of trust. It's quite common in the investigator, a lack of trust in the authorities in general. Anger around the lockdown and some of the regulations and the enforcement of those regulations. And remembering always underlying this, the 5 stages of grieving, which can affect the emotional reactions in so many cases. The denial, anger, bargaining, depression, and finally acceptance. Then there's a very real fear of stigma and discrimination, which came out in the role play, with a school child possibly being concerned about stigma at school. And we've seen this play out in very unpleasant ways in some of the cases that we've contacted. Very first case being chased out of a hockey, other family living in fear and dread of community reaction and attacks on social media and so on. Special scenarios. Muzamil and Masuda have talked a lot about the phases of the epidemic. And so in the early phases, there were very different scenarios from what we were coping with now. So dealing with people who'd returned from skiing holidays, who were well informed, able to isolate with no problem whatsoever, and that wasn't an issue. And then the period of workplace clusters, we found ourselves going way out of our comfort zone, advising workplaces around how to decontaminate their premises and follow up their contacts. But now, the sorts of scenarios in this phase of community transmission, we're finding large, complicated households with a few rooms and hockeys in the back, and a combination of cases and symptomatics and high-risk grannies and whatever, all under one household. There are also many people living in informal settlements where they are sharing taps and toilets with neighbors. And in both of these scenarios, obviously, the risk of transmission is very high and the possibilities for quarantining and isolating are minimal. And this is where one would maybe want to offer formal accommodation, but people often turn that down for many reasons, some of which I think is a fear of never seeing their family again or their possessions being stolen while they're gone. Then we have particular old age homes and care homes, and particular efforts be made in the province to try and mitigate against transmission of the virus in those settings. Workplaces, businesses, health facilities and schools. And in all of those particular scenarios, one can call on substructure, will actually investigate further at those care homes and health facilities, and that if necessary, it's not something we have to do And increasingly, we are coming across cases we interview for the first time who actually need urgent assessment. Remember, there are always clinicians on board in the pod, hospitalized cases and cases who have passed away when we are dealing with families who may be fearful, unable to get information from hospitals, or are in the early stages of grieving. I asked members of the Kaya Pod to share with us some of their reflections on the experience and meaning of being members of the Kaya Pod. And these are some of the things they came up with. The theme of providing hope was a very strong one. The feeling of being able to hear the relief in someone's voice. This person said, I felt very emotional learning how scared people were to learn that they tested positive. Other quotes here. I think for a lot of pod members, being exposed to people living in such different circumstances from their own, whom they may never have engaged with previously, has been, as this person said, enlightening. It's been moving. People are resilient. They're happy to share personal details. There's even moments of humor. Hearing grateful voices, and this is important. Although I could provide no medical or other assisted advice, they just needed someone to listen to their experiences. This theme came up a lot from the case investigators. The best advice I could give at this point is just get started. That first call you make is the hardest. Just get through that first call, and then the kindness, the compassion, the intuition kicks in. It makes sense as to why you're doing this. And here are some beautiful, fresh faces, a huge, diverse members of the Kaya Pod, from the young ones, middle-aged, right through to the wise and wizened amongst us. Just to reinforce what I have been saying about the meaning of this process, are some SMSs that some of the pod members have received from their clients, from their cases. I just love this particular one. Thank you, sister, for checking up on us. Sometimes we don't know what to do when having funerals under the lockdown. You calling us showed support. We appreciate that. Don't stop showing support even to others during these difficult times. This was from a man who'd lost his wife. And then several SMSs telling case investigators, I just want to inform you my wife is feeling much better and she doesn't even feel pain and she's breathing normally. My mother sends her regards. She says she's really glad she knew you in this time when she was sick. She kept holding on to advice and she really is feeling so much better. If you are watching this video in the Western Cape, we're looking forward to having you join our team, having provided such strong motivations for you to do so. And I'd like to just thank, on behalf of the whole team, the Department of the Western Cape, the Health Department of the Western Cape, and the Department of Public Health of the University of Cape Town. Particularly like to thank the members of the Kaya Pod who've contributed their experiences and feelings, and to the cases and contacts that we have engaged with over these last 3 months.